on. So welcome everybody. I'm Hannah Nicholson. I'm one of the leads for education at CoLab. And I'm really excited about today and our talks this afternoon looking at health inequalities and considering this in the context of children with medical complexity. I'm really excited to introduce you to some fantastic speakers this afternoon. And to leads for WHAM, so that's Goody Singh and Hannah Zhu. We've also got speaking Tammy Benziken and Gail Manning and Mary Salama. And hopefully this afternoon is just going to spark lots of questions and lots of thoughts as to what we can do moving forward to improve the lives of children with medical complexity and think about the impact of health inequalities and how we can, make changes. So I'm going to pass you over to Goody, who is going to give you a bit of an introduction about WHAM and what they've been doing.
Brilliant, thanks Hannah, and thank you to CoLab for having this and hosting this event. My name is Goody Singh. I'm a consultant paediatrician, but I'm also the co-founder and director of an organisation, tiny organisation called WHAM, which is the Wellbeing and Health Action Movement, and which you're going to be hearing a lot more about today. As I said, it's a real pleasure to be able to do this as a co-hosted event with CoLab. We share so many values. And prime in that is this idea of wanting to share good practice so that we can share whatever resources and energy we have in terms of improving healthcare for children. Now, today's webinar is called MAD, Making a Difference for Health Inequalities in Complex Children. But the truth is that all children are complex. And that's not just because, they might be difficult, but actually because they're beautiful, intricate individuals. And I also want to argue that all medical presentations are complex because not that they need specialist postgraduate training, but because of the layered social, economic, political, and environmental factors that play into health in the 21st century. And today, we're going to be discussing what it means to deal with that kind of complexity head on. Because the real question I want to ask you today is, are you mad? In the face of such complexity, are you making a difference? So we begin today with stories, and stories are what helps to describe the nature of the problem that we're facing. We'll then take a little break to go to the toilet, and then we'll come back rejuvenated, and we're going to then think about solutions. Now, thankfully for all of you, it's not just going to be doctors talking today. We are thrilled to be joined by a play therapist called Gail Manning. We also have very special guests joining us to be interviewed, one of whom is called Grace, and another who is called Rhea, who is a young person who herself has experienced long-term conditions and complexity and is willing to feed back in what we're saying today. I'm going to ask everyone who's speaking, doctors mainly, to try and speak as plainly as possible, because if our patients can't understand us, that means we're not doing well enough. We're not doing this clearly enough. And that includes me. So to Grace and to Rhea, call us out when we are not speaking clearly and ask for clarification, because I can guarantee you that everybody else will be thinking the same thing, and I'm really glad that you've asked that question. So let's get started. I will say that questions may come up for people as we're talking. Please put that in the chat if there's something that you feel you want to happen immediately. People will be watching the chat, and so we can bring up some of these issues later for a discussion. And the other thing I also want to say is that this is not just a series of lectures, it's a conversation. So when someone has stopped speaking, that is the time to raise your hand and to speak. And for the benefit of those special guests who are joining us, if you wouldn't mind switching on your camera just so they can see who is speaking to them and who's addressing the question, that would also be really, really great. Okay, in true team style, because I don't know how to share my slides, Kelly, please can you share my slides? And we will get started. So,
can you see that okay?
I can. Can you put it onto the first slide? As in like when it's like presenter mode or whatever. Yeah, fabulous. Okay. So next slide, please, Kelly. Right. So unless you've been sleeping under a rock, people, you'll know that things are not in great shape right now. It's October 2023 and the UK is on a knife edge, right? We've got public health sector workers who are on the picket line. The cost of living crisis is burning on and our leaders are in total disarray. The question is, what does it mean for kids doctors like me? Well, it means that we've got 4 million children who've been living in poverty since 2020. And it means that people like me are seeing the effects of deprivation in ever-increasing numbers who are attending hospitals and clinics. It means that we're seeing malnutrition, we're seeing infections, we're seeing delayed development, we're seeing the kinds of Victorian illnesses that we read about in Dickensian novels. Last year in England, 312 children were hospitalised with scurvy and rickets. And next slide, please, Kelly. And that's not even to mention the staggering levels of anxiety, self-harm, and child abuse that could all have been preventable. Next slide, please, Kelly. For doctors like us, it means sending kids home to the very conditions that made them sick in the first place. Next slide, please, Kelly. Now, the worst part about being a paediatrician in the UK in the first part of the 21st century is how helpless I feel knowing that the lives of the children I treat are somehow constrained by the accident of their birth. Because for most children, their skin colour, their gender, and their socioeconomic status, or where they happen to fall on that graph, all have more impact on their life outcomes than the particular disease they came into hospital with. Now that is the social determinants of health in action. Those are the conditions in which people are born, work, grow, live and age, and they are the wider set of forces and systems that shape the conditions of our daily lives. Sadly, they are what are behind health inequalities, the systematic differences in health between different groups of people. But if I were to just focus on numbers, that would only get me so far, because numbers don't really provide an explanation for why Black men were 3 times more likely to die of COVID-19 than white men of the same age, or why women who will spend more years of their life in poor health than men, even though their life expectancy is higher at birth. Data does not give us the understanding we need to understand why a patient who is trying to get to clinic on time may still miss their appointment when transport costs are unaffordable and there's nowhere to park. And statistics can't explain why people can't take their meds if they can't read, or why telling a parent that they need to play with their child more is easier said than done when there's not any space at home and they can only afford 1 box of nappies. Now, the fact is, as doctors, what we end up doing is sending people home with drugs that don't work, and then we complain when we have to see them again the very next day. This is complexity in action, and numbers alone will not tell us how to solve it. Health inequalities and social determinants of health are what are behind all of the graphs, just like this one, that people like Michael Marmot keep on producing to confirm what you and I already know, which is that health outcomes depend on where we happen to fall on that social gradient. The social determinants affect every single aspect of the life course. They affect our ability to recover from disease, to access care, and your ability as a clinician to do your job properly. And left unattended, the social determinants are bad for our health. Next slide, please. But you wouldn't realise that from what is happening on the ground. Now, a recent report from the Royal College of Physicians looked at clinicians' confidence in talking about and understanding health inequalities. And of the almost 1,000 clinicians surveyed, 67% said they had not received any teaching or training on health inequalities in their training programme or part of their degree. A measly 26% said they felt confident in their ability to reduce the impact of health inequalities in medical practice, and only 31% felt they could even bring it up with their patients. Now, when clinicians fail to talk about the social determinants of health or health inequalities with their patients, it's resulting in missed opportunities to make every contact count and to make our contacts meaningful and materially significant. Modern health systems and medical training are not only consistently failing to identify the real causes of illness, but they are also systematically failing to equip clinicians to do anything about them. And in that void that's left by our training, clinicians are consistently reporting feeling hopeless, helpless, and burned out. And how do I know that? Well, because I was one of them. And I have to be honest, next slide please, Kelly. I became a bit depressed when I realised that medicine didn't really care about whether you had enough of the right kind of food to eat, or what your house was like, or whether you had enough money to pay your heating bills. Over and over again, I'd be told, that's someone else's job, sweetheart. But whose? What is going on here is a kind of blindness. On the one hand, medicine is blind to all of the antecedent drivers that bring patients to our doorstep. And on the other, medicine is blind to all of the particularities of the human who's at the centre of it all. And worse still is that we let it happen. And so we are also blind in our own complicity in this whole mess. Next slide, please, Kelly. Now, the reason that I haven't burdened you with real graphs or with real data is that you've heard it all before. I don't need to tell you, because even if you were unaware of the issue of health inequalities pre-2020, I think COVID blew the cover off that one, didn't it? And we can't pretend that health inequalities don't exist anymore. For years now, we've had edicts from all the important places telling us that health inequalities exist, that they are wrong, and that we should be making every contact count. We've also had declarations about the importance of the patient's voice, and ideas like co-production and patient-centered care being bandied around for decades. And yet, nothing has changed. Health inequalities are wide, and despite increasing attention, they're not getting any better. Be honest with yourself. How much of your clinical practice has actually changed in light of a single report that Michael Marmot has published? How much of your practice has changed to genuinely put service users in charge of their care? And how much of your practice has changed to consider your own role in exacerbating health inequalities? We keep hearing about this hard to reach population, all these people who just don't come to the NHS. But who are the real people who are hard to reach? They're the doctors, specialists, people like me. We're holed up in our ivory tower institutions and our clinics, and we're protected by bureaucracy, secretaries, and referral systems that are all but impenetrable. Now, health is one of the fastest growing industries in the world. It costs $10 trillion in 2022. Billions are being pumped into pharmaceutical, genetic, and technological advances every single year. But if we know that lifestyles and living conditions contribute 80% to population health outcomes and healthcare only 20%, what are we doing? Next slide, please, Kelly. We need a new way to practice medicine, one that creates health and not just fixes disease, and one that sees the whole patient, not just individual organs. One which fundamentally understands that health needs social justice. But it's one thing to feel that things are not right, and quite another to do something about it. If the health profession wants to move beyond mere words towards genuine action on health inequality, then we must take responsibility for developing the know-how, skills, and networks for ourselves. And that's why Hannah, Tammy, and I started WHAM. Next slide, please, Kelly. WHAM, which is the Wellbeing and Health Action Movement, is an empowering through education organisation, and it formed in 2021 by us when we were all just trainees responding to health inequality in the wake of the COVID-19 pandemic. Now, WHAM began as a social incubator or a digital platform. Next slide, please, Kelly. And the idea is that it's about the peer-to-peer sharing of knowledge, tools, and communities, and it's about informing, empowering, and uniting clinicians who wish to address the social determinants of health and health inequality in their clinical practice. WHAM arose because of the gap that exists between the growing desire within the hearts of clinicians like me who want to address the social determinants of health, but who are met with a total lack of support when it comes to conventional medical education and practice and training. So we knew, Tammy, Hannah, and myself, and Helen, who's also not here, and Emma, who is also not here, that it's going to be much easier to try and work together than ever trying to do any of this alone. And that's why we became this grassroots distributed network of very ordinary clinicians, and can I just add, of all stripes, not just medical, who are connected digitally across the UK. Next slide, please, Kelly. Our goal is to help to shift the attention of health systems and health policy towards an upstream, holistic, and equitable vision of health and well-being. And we want to do that by changing health professional cultures, capabilities, and ultimately the care that is delivered. Because we believe that the time for talk is over. Next slide, please, Kelly. It's time for clinicians to step up and walk the walk on health inequality. But what does that look like in practice? Well, we're going to discuss that in the second half of today's session. But first, an understanding of what the problem is like from the health perspective is all well and good, but what is it like on the other side of the desk? I'm now going to hand over to my colleague Hannah and our very special guest Grace to help us to understand just what medical and social complexity looks like in real life. Thanks, Hannah.
Thank you so much, Goody. What a great introduction. Kelly, I was wondering, could you share the slides that I have? for the patient journey?
Yeah, just give me 2 seconds.
Thank you. Brilliant. Thank you, Kelly. So for this next part, I would love to introduce Grace and Adrian. And they're a really inspiring family who are the patients of one of my colleagues. And they very kindly, Grace has very kindly agreed to share her story with us and hopefully teach us a lot about what we can do better. And also just help us understand what are the most difficult parts, what are the parts where we need to do better, and what the good parts were, and to encourage us and encourage other families that we can do our part to help families through really difficult times. So next slide, please. I just wanted to tell you a bit about how I met Grace. So this was back in February 2023 at the Evelina. And so we've been trying to co-design and work with families to create resources that will be helpful for families who are experiencing health inequalities. And we firstly wanted to do that by mapping patient journeys, and Grace was one of the really wonderful families who came to this workshop. And everyone who came had children with disabilities, either cerebral palsy, autism, ADHD, for example. And what we did was map their patient journeys to try and understand what they've been through, and also co-design some cost of living resources to help them access things more easily, to signpost to things that help with income, essentials, and also joining in the community and accessing charities that may be able to help as well. We also had lots of community partners at this workshop, for example, health visitors, a children's centre manager, children with disability social worker, and also a sleep nurse. And all the participants were able to meet, all the parents met with these community partners, and also we followed up with community partners afterwards to continue to support these families. So Grace was particularly inspirational. Next slide, please. And I would love to introduce her now as a wonderful, committed mother who has moved mountains for her son Adrian. And firstly, Grace, could you tell us a bit about Adrian and what he's like?
Okay. Adrian was in Kenya to start with, and he was admitted in ICU the very first day of his birth due to breathing difficulties. But we were in different hospital, and it took me 1 week for me to see him again, and it was very traumatic a moment for me. And we came in UK April 2022. Now Adrian loves Adrian is a very happy boy, and he loves using mobile phone to select his own music by himself. And now he's in school and he's doing well in school. He loves swimming, he loves walking, and he loves music lessons.
That's so lovely. That's all very true. He's at one of the schools locally in Liberty. Sorry, carry on. Next slide, please. Kelly, could we move to the next slide, please? I was wondering, Grace, could you tell us a little bit about the journey you've been on with Adrian since arriving in the UK?
Since we arrived in UK, it was very stressful moment for me because I did not know where to start, and I had a special need child. So I had to call Doctors of the World, who assisted me to register with the GP and to start with the process of him to be in the system so that he can start medication. And also the Doctors of the World, they are the one who assisted me to start with a food voucher because I had no money and my son needed diapers, needed food. So they're the one who introduced me to all those systems. And after that, now I've been trying to to help Eden in so many ways. Like for him to be in school, I had to do EHCP by myself online because I did not know who to assist me. I did not know where to start, and I wanted Eden to be in school, so I went online just to see how I can start the process so that Eden could be in school. So it took me time to start the process because I did not know where to start or what to do, and there was no one to tell me do this and this because we were just new in the country. So I just followed online thing and I started the application and I did the application. But luckily, the one who took the file after the application called me, and that's now when I told him about my situation, and he did help me by putting forward my case so that we can start it as early as possible. And it happened, and that's how now I started the process of EHCP.
And Grace, just please tell us, how long did it take between initially you wanting him to be in school and for him to get the HCP and then for him to start school? How long was that whole process?
I started the process back in May last year, and it
May
took
2022.
and it took around 6 months for the EHCP to be completed so that he could start school this year. And the school that now the praise we got the praise at the Rivity School in April this year.
Okay, so it took nearly a year to actually get him in school.
Yeah.
Okay, I'm sorry to hear that. I'm really happy that he is in school, but we need to improve that process and make that easier.
Yeah, it's nice when someone is going through difficult situation like that. At least there could be someone following up, like from the council, just to see how the progress is, because there was no one to assist me. I was just alone, and it was so difficult. Even some question I did not answer well. Nothing. I just doing so that my son could be in school.
Absolutely. Well, brilliant that you got him in school. Absolutely. But we need to think about how we can do that better and work with education and social care to make that much easier for you, because it was really difficult. And I remember when I met you, that was a real struggle.
It is the most difficult part when someone wants
Yeah.
her child to be in school and you don't have anything to, you don't have anyone to assist you or to tell you you should do this and this. Yeah.
Yeah, absolutely. Can you tell me about some of the other things in the last year that that you've had to overcome, like for example, to do with housing, for example? And we're still on that journey, I know, but
I'm still in that journey
how that's
now.
evolved.
Yeah. The housing, it has not been sorted yet. We are still under initial accommodation because we are asylum seeker to start with, and before we are being given a house, it takes time. Like now we were offered a house in Ealing, but due to some agent transportation issue which was not sorted, we could not move because he could miss his school. So we're still in the same house until the transportation issue is sorted by the Home Office, of which it has not happened up to date. And it is really, the house is very small. Agent can't even move. There's no place for him to even to sleep on the floor to do his facial thing. So it is very squeezed room full of equipment, which is very risky for him because sometimes he can get hurt. So yeah, it is very, very a very hard moment for me until I don't know when will these things be sorted out. And considering his needs, it's very risky for me to leave him here alone because he can get hurt, he can fall. So it's really challenging.
Yeah, I'm sorry to hear that, Grace. And this is the second house you've been in, right? Because previously, I think you were staying with a friend in a very overcrowded place. And actually, this is your own place, but it's still, it doesn't have cooking facilities, right? And and it sounds like it's really not suitable still.
I have to hustle to go and cook for my son in my friend's house and come back with food. It's a tiresome journey because he doesn't eat any food. He doesn't eat spice food. He has a specific food, African food, which he has to eat. He doesn't want any mixture of spices or anything that is not African. He can't eat. So it is a really tiresome situation, and I have to go carry food, come here with us so that I can feed him, and it's really tiresome for me. Even my well-being, sometimes I just feel I need to give up, but I can't because I have to be there for him. Yeah.
And you are amazingly, amazingly strong to have gone through all of that, definitely. We're still working on the housing situation. So
Yeah.
I think, I just really hope that something becomes available more locally so he can travel to school. But yeah, could we go on to the next slide, Kelly? So we talked a bit about the school and the challenges with that. Is there anything else you'd like to share about his journey in the last year from like a kind of medical perspective or in terms of
his journey, like social worker, we have never accessed one. I have really tried to request even at least for support for me to go even a little bit a short break, but I have never accessed one simply because we are asylum seeker. We are not entitled to so many services until get leave to remain. That's what they tell us, but sometimes it's really stressful because you need to go for a break because it's too much for someone to be alone, doesn't have anyone to assist, and you are dealing with a special needs child. You are doing all those things by yourself, no one to assist you. So it is sometimes a very challenging moment for a parent who has a special needs child. Yeah, and social work up to now, I have never accessed one. Like now, other things like housing, that's another challenge. Transportation challenge, because simply we are asylum seekers. So even the cabs, they don't do, when you go to cab companies, they want you to deal with the council. And sometimes when you go to the council, they're telling you until you have a leave to remain, that's when you can be given this and this. So it is a quite tough journey.
Yeah, definitely. Okay, how do you think things have changed now that he is in school? So since I think April 2023, how have things been? Because that must be a big change for you from having him all the time to kind of having him go to school.
Since he's joined the school now, at least I can relax for 6 hours. And also school is very, very supportive towards Adrian. Adrian nowadays, he has really improved a lot in terms of concentration, in terms of social skills. He's doing a lot, and the school are so supportive. They do sometimes provide vouchers for him to buy some milk in the supermarket. So they are really supportive. And with the school, Adrian has really done well in so many parts of his growth and mobility in so many great and wonderful ways. I do appreciate the school so much.
Oh, great. I'm so pleased to hear that. And yeah, he looks very happy in the photos that you've shared. Can we go on to the next slide, please, Kelly? So I think we might have talked about some of these things already, but I think from your perspective, Grace, what were the most difficult parts of your journey? I know we've talked about housing and accessing education and social care with disabilities team, but is there anything else you'd like to add in terms of the most difficult parts?
Most difficult part, accessing services. That's the most difficult part, because you are just new in the country. You have a special needs child, and you don't know where to start. No one to put your hand. That's the most difficult part ever.
Of course. Yeah. Okay. And I guess if you were to talk to yourself as someone new who's arrived in the UK and who didn't know how to access these services or didn't know how to do that, what would be your advice to them?
My advice would be to go to the council, or to go to online, online to try and apply things online and express the situation, because before you reach the council, it's a process. You can't just go, that you have to have an appointment. But when you do things online, they will see it and they will give you a call. So I think online thing is the best thing to start with, and also for a person in the country, so that can get the system, like GP or NHS number. I could advise them to call the doctors of the world, so because they can assist in a great way, like how they did to my son.
Brilliant. It sounds like the doctors of the world did a really good job and made a big difference there, huh?
Yeah, they
That
really
certainly got the journey started.
Yeah.
So what things do you think went especially well for you?
The day he attends school, that was the most happy moment of my life. I could see the struggle that I had went through. At least finally he has access a school. That was very, very happy moment for me.
Brilliant.
And yeah, the rest will just follow. I just encourage myself, as long as one day at a time he's in school, the rest will come one day at a time.
Yeah. Okay. Well, that's great. I think that's a really lovely way to look at that. And what do you think, from your experience, what could we as doctors or education or social workers or any therapists within healthcare, what could we do better for you and other families in a similar situation?
Helping the special need mother or parent to access services. That's my request. Because when you go to council, they're telling you you don't qualify, and yet you have a specific special need child who need extra help, extra care. But through your help, there at least they can consider and see, we should at least and try to help this family. Accessing services is the most appropriate and the very, very, very first thing that it can really help a person who has a special need child.
Yeah, absolutely.
Yeah.
Thank you. And you've helped us to do that a bit better. You definitely help us improve how we do that, Grace. So thank you so much.
And
Yeah, there's a comment from the chat saying, like, hats off, very impressed at the persistence and how much you've done for Adrian, and you've been his biggest advocate, definitely. That we as doctors and as healthcare professionals, we also need to be big advocates for each one of our patients, especially patients like Adrian. And thank you for taking the time to help us learn how to do that better. Next slide, please, Kelly. But yeah, I wanted to say thank you so much, Grace and Adrian. These are some lovely pictures of Adrian on the bus, and I love this bike setup you've got there, Grace. That's really good. He looks like he's loving it. And I just want to say thank you so much for sharing your story. Is there anything else you wanted to say, or is there anything else anyone wanted to ask Grace as well?
Yeah, I can add this. There is a friend of mine here who doesn't know how to speak English, and she has a special need child. When it comes to services due to language barrier, she can't access. So I was the one who assisted her to do the EHCP online, because she was here 2 years, but her child was not in school. So I think language barrier is so difficult when it comes to a parent who has a child with special needs. So I think when a doctor or social services, when a person gets engaged with a person like that, it's good to follow up to assist where he or she can manage, because she was just here and she did not know the process or where to start for her child to be in school. But when I stepped in and did the EHCP online for her, things worked well, and now her child is in school as we speak now. So I think follow-up can help, and doctors, when you meet someone like that, it's good to know if she has applied for EHCP or something like that, so that her child could be in the system and could be in school.
Yeah, definitely. Oh, it's amazing that you were able to help her with that. And you can imagine it's even harder if you don't speak English to access any of these services.
Exactly.
It's just so difficult. But you've highlighted that really important point, and it was wonderful that you were able to help your friend do that. But we should also be doing that more. Mary, sorry, you had your hand up earlier. Is that right?
Yeah, I didn't know whether to ask now or wait till later, but I've got so many questions. Such an interesting, and thought-provoking account. So thank you. I just wondered how all of this made you feel, because I think if I was trying to navigate this and not having any time off, and my child was, not in school, and and all of this stuff, I think sometimes we come across parents of children with lots of medical issues that can come across as quite angry and upset. And I think that you seem very calm, I have to say. But I wondered whether you had any comments on that in terms of the frustrations.
I could feel frustrated. I could feel low because there was no one to support, to help, even physically, psychologically, mentally. It was so tiresome. The process, everything I could do by myself. So it wasn't an easy journey. It needed someone who has a big heart, someone who has strength to do what she can for her child. It was so tiresome. Sometimes I could just go into room and cry because the EHCP by itself, there was a lot of questions, but I did not even have answers to some. And yet I wanted my son to be in school. So it was so tiresome and very frustration journey. Yeah.
Can I just say, Grace, that you do have a massive heart. Like, you have a big heart, and it's only because you are an incredible person that you could have jumped all of these obstacles. And obviously your children are lucky to have you as a mother. But I wanted to, if it's okay with you, to ask you to have a little conversation with another service user in our midst. So Rhea Berman is a very talented young person who has unfortunately had to undergo a similar experience, but from the other end, because she's the actual patient in this case. And Rhea, if you're willing to, I'm sure you've got something to reflect here in terms of some of these obstacles, and maybe in particular on the education side, just like Grace has had to endure. I think you're on mute, Rhea. Can't hear you. Try now. Oh no. You can hear us, yeah? Do you want to go in and come out again? Classic.
I think meanwhile we had a few really good comments in the chat, so I just want to encourage you, Grace. So people thank you for highlighting the difficulties for parents, especially with the language barriers, and we don't understand the burden of care that parents carry. And thank you for helping us to try and understand that more. A challenge to us as doctors and other professionals should be just as robust, if more, than we pose to the parents. And we should be, our heart needs to be as big as yours, Grace, yeah, and we need to be able to respond adequately as well.
Yeah, totally. And while we're waiting for Rhea, I feel like a lot of the comments are talking about how systems are structured, right, in terms of making these obstacles in the first place. And I often feel when I'm in the doctor's seat that I am as much a victim of these systems as the patients are, because I don't want them to have to do this either. I don't want them to have to go through the ridiculous EHCP process, or to have to go through like any number of assessments before they get any help, or like when we do migrant care, right? In order to access care, I have to it's this horrible charade we're all playing, where we're all trying to, well, at least I do. I'm trying to get as much as I can for my patients, right? And so the question is, like, why do we end up being in this game where we're having to like figure out how to do this for our patients? And Grace, maybe you can reflect on this. I mean, you must have felt sometimes like you and the doctor are somehow trapped in this crazy game where you're trying to figure out the rules so that you can somehow win, even though all of the rules are pitched against you.
Yeah. I could try my best so that Eden could be in school. So sometimes I could even write emails to just to know the progress. Just like what is the progress? How is the things going on? So sometimes it needs you to push by emails, by calls, so that at least things can work for you. But if you just keep quiet, you'll be just be like that. Nothing is working at all.
You're absolutely right. Yeah.
Rhea, can you speak to us now?
Wait, is it working?
Yay!
Okay, nice. Yeah, so a bit about my experience. So I started in the system when I was 15, but got diagnosed at 16. So I was in my final year of GCSEs, and because everything happened very, very quickly, at like 15 and 16, whilst being incredibly unwell, I took essentially the year off school, and my mum was trying to scramble at ends, trying to get me access arrangements to sit my exams, trying to find like extenuating circumstances to see if I could do my exams the year after. And it's so hard. Like, I was very, very privileged in the position that my head of year managed to contact my doctors and, you know, liaise with them. But I was expected at 15 to actually do all of the liaising whilst I was very unwell, which I think was incredibly unfair. And my mum was then trying to sort out and scramble and trying to contact all these people. But they, again, like, it was so unhelpful. And my mum had to do that for my brother as well, which is very unfair. So yeah, that from my point of view, that was kind of like the way that it kind of impacted my education. And then trying to get those papers and evidence again when I was going into sixth form was like a whole nother stress. And trying to get that all done in time of my exams whilst trying to revise is, you can imagine, pretty stressful. So yeah, that was kind of my perspective on it.
Thanks, Rhea. And that's really, really nice to hear your experience. But again, like, I just feel terrible that you had to go through that, and then that you should have to have scrambled. And as you said, to get the papers, it's always about the papers and like proving to people that you're allowed to have what I would say is just basic humanity in this case. But I'm really aware of the time and the fact that we have a whole other second session to come. Do people want to have a break to go to the toilet, etc., or shall we plow on? A break. Okay, very quick break, like literally 3 minutes, and then we'll 5 minutes. I'll see you back here, and then we will start the second session. All right, and thank you so much again, Grace and Rhea, for your contributions already. We'll see you